Yeah, I'll try my best, but
All right, so we are gonna let folks go ahead and we were just figuring out some
especially as
things
people
about
come.
our ASL interpretation. All right. So welcome to Innovation in Child Abuse Prevention, the Center for the Study of Child Abuse and Neglect's 90 by 30 initiative. We are very fortunate to have them join us today to talk about the programs and about this really amazing, innovative initiative that they're currently doing in Lane County, Oregon. So let me get this. This webinar is brought to you in collaboration with the Office of Child Abuse Prevention and Strategies TA. Strategies TA is a collaboration between the Children's Bureau of Southern California and the Child Abuse Prevention Center in Sacramento, or North Highlands, I should say. So just to get you oriented with Zoom, we have some features that we're going to be using today. When we have a discussion, we will have there'll be a moment where you can unmute yourself. Right now, everyone is muted. We do that to kind of reduce the background noise while we have speakers, but there will be opportunities throughout this webinar where you will be able to actively engage in questions and conversation, and we really look forward to that. You can also turn your video on or off. We love to see everyone's faces since we're not able to have in-person events. We just love to see all of the people that join us on our webinars. And the way that you will be communicating with us will be in the chat. So you'll see that there is a chat feature. So please enter in any questions that you may have. We have some accessibility for folks that are deaf and hard of hearing, and my colleague Rosalind will be able to talk to us a little bit about how that will work.
Good morning, everyone. We will be providing ASL interpretation as well as closed captioning. So live captioning services. There's also going to be information about video relay service for anybody who would like to use ERS for the breakout sessions. And I'll go ahead and enter that into the chat, okay?
So for the captioning, we do have a link to that to stream text. So we will go ahead and put that into the as well so that you may be able to access that. So there is a link in the chat for those that need live as well. All right. So if you have questions about the ASL interpretation or how to pin the ASL interpreters, please feel free to put your questions in the chat and we will get to those to be able to support folks that need it. We just want to make sure that we have all of everyone taken care of and make sure that they are able to access this. So we're very fortunate today to have two amazing folks from the 90 by 30 initiative from the Center for the Prevention of Child Abuse and Neglect. Excuse me. And I'd like to introduce our first speaker, Jeff Todahl, who is an associate professor in the Counseling Psychology and Human Services Department at the University of Oregon and the director of the MS degree in counseling, CFT. He is the director, co-founder, and director of research with the University of Oregon's Center for the Prevention of Abuse and Neglect. Dr. Todahl's research centers on violence prevention, and community engagement as a vehicle for reducing child abuse and intimate partner violence. He is co-founder of the 90 by 30 initiative, and his research centers around violence prevention, community-level protective factors, and community engagement as a vehicle for reducing child abuse and other forms of interpersonal violence. He is currently measuring child abuse and neglect rates in Oregon. Oregon Child Abuse Prevalence Study has partnered with the University of Kentucky and 24 universities to evaluate sexual assault bystander prevention effectiveness and works actively with the Ford Family Foundation on an Oregon-wide evaluation of stewards of children. We are also very fortunate to have Sara, Sara, your name is spelled incorrectly on this. Sara Loveless is the Associate Director for 90 by 30, a community campus initiative housed at the University of Oregon designed to reduce child abuse and neglect 90% by the year 2030 in Lane County. Sara has long served as an advocate for women and children. She led girl empowerment programs, Girls on the Run, Heart of Missouri, and has overseen local campaigns of national programs, including La Leche League, the Baby Friendly Hospital Initiative, and Project Launch, linking actions for unmet needs in children's health. Her passion extends to children's education, established an education foundation in rural New Mexico, and volunteering extensively with Columbia Public Schools and Eugene School District 4J. Sara has served as an early childhood classroom teacher, as a certified instructor for both Music Together and Roots of Empathy curricula, and has worked with children in yoga and movement classes. Prior to her career shift to work with children and families, Sara served as Public Relations Officer for organizations the American College of Rheumatology, St. Louis Science Center, and Anheuser-Busch. So I'd like to introduce Jeff Todahl and Sara Loveless.
Good morning. I'll start. My name is Sara Loveless, and as Lydia shared, I'm the Associate Director for the 90 by 30 initiative housed at the University of Oregon. I have been working with 90 by 30 for 3.5 years, which was shortly after I moved to the Willamette Valley and Eugene, Oregon. And what spoke to me about this initiative was what felt like a unique perspective in bringing the responsibility of reducing child abuse and neglect from sort of the small world of teachers and families and kids to a place where the community was responsible for supporting families and children. And that 90 by 30 was doing this work to connect those in the community to actual ways, task-oriented and easy to implement ways that they could make differences in their community really spoke to me. So I'm delighted to be here this morning to share our work, and I look forward to hearing from you.
Hey, thanks, Sara. Hi, everyone. And hey, can you see the screen and what I've shared? Can you see that okay, Lydia? Okay. Great.
Looks good.
Nice. Hey, thanks so much, Lydia, for the invitation. And what Sara and I had in mind today is to just share with you how our community is thinking about child abuse and neglect prevention, some of the things that we're doing. And we really come at this with a sense of humility. So we've been working at this for a while, and I understand that's true for all of you and your communities. So everything that we created ourselves and that we share with you today, if it's useful for you, think about it as yours. It's yours, and take any parts of it. And we'll move through some detailed kinds of strategies and efforts that we've been working on here. So we want to give you a sense of who we are, what we're doing, our attitudes, and a couple of things just in terms of some context. We think about child abuse and neglect as a human rights, a social justice, and a public health issue, and that it is a systemic problem that really requires systemic solutions. We think the Child Act is preventable, and we're really committed to the notion that it's so important that solutions are generated within communities and then are implemented by local communities. That is really at the heart of what we've been trying to do in our community. So I just invite you to as we share what we're doing, just weigh it in terms of its value for you, and take any parts again that hopefully will be useful for you. We are in Lane County, Oregon, which has a population of about 380,000 folks. We're about the size of the state of Connecticut. Our largest city is Eugene, where the University of Oregon is housed, with about 170,000 people. And then outside of that, we get pretty rural pretty quick. And Eugene, we consider it a city, but for a lot of us, it's a small place. And just a bit about some of what we know in our community about prevalence. And just let this sit in for a moment. Y'all are doing this work, so you know these percentages. One thing I want to just really highlight is this information is being taken from youth in our community with something we're calling the Oregon Child Abuse Prevalence Study. So this is an extrapolation of what we know about adults and rates in our community. So 103,000 of our adult neighbors. And as we translate that to youth in our community, about 23,000 youth in Lane County have experienced child abuse and neglect. And then I just want to center in a bit on what we know after having asked youth in our community about the kinds of abuse and neglect they may have experienced. And this is drawn from, again, the Oregon Child Abuse Prevalence Study, which is available on our website, and we'll throw up some links in a little while. We did something that was sensitive here, and I'll just say a bit. We went into Lane County high schools in a pilot and brought a Palm Pilot in, and students completed the prevalence study questionnaires, very sensitive, some 160 questions about abuse and neglect they may have experienced. We also asked questions about protective factors, things around resilience. So it's more than prevalence. And we came to see this as really a youth empowerment project. So, but just to go inside of that a little bit, here are some of the questions we asked our youth, and these are juniors and seniors. Questions around sexual abuse. Has anyone ever touched you in your private parts in a sexual way or made you touch theirs when you didn't want them to? Have you ever been physically forced to have sex when you did not want to? And we asked about 17 or 18 questions of that nature. And 29% of our youth said that was true for them. 14, nearly 15% had 3 or more types of. We also asked questions about physical assault. Questions like, has anyone ever choked you and prevented you from breathing? Has anyone ever hit you over and over again with an object or fist or beat you up? And these percentages that you can see on this screen, we removed anything that was spanking or peer-based physical assault. This was only adults being assaultive toward youth in their households. And 39% of youth in our community said they experienced 4 or more types of physical assault. We looked at some things around emotional distress. Students with 3 or more types of sexual abuse were 2.1 times more likely to report that they were persistently sad or hopeless compared with all other students. And we looked at how this related to grades. And kids who told us that they were receiving mostly D's and F's, 82% of them answered yes to just this one question. So these are mostly kids who are really struggling academically. At any time in your life, did any of your parents or another adult in your home, because of an argument, break or ruin anything in the house, or punch the wall or throw something? And so kids who said yes to that one question, over 80% were receiving D's and F's. And then I want to just center attention too on this. We asked those youth who had an abuse history, had they ever shared this experience with anyone at any time? And what do you imagine? What percentage of our youth said, no, I haven't, I'm a junior and I'm a senior, I'm 16, 17, 18. I haven't shared this with anyone at any time. And in our community, we were right at about 47% of our youth who said, no, I haven't told anybody. And of course, that's not an accident. You'll have probably a deep understanding of the cultural factors that contribute to our youth feeling like they don't have an avenue to talk about this. And so we think that's one of the places where we can put attention, that there's some work we can do there to reduce that social factor where kids feel like they can't talk with anyone about this. So that's part of where our work is for the 90 by 30 initiative. And just a little bit about our history, and then we'll get into the specifics on what we've been doing. We wanted to, and I think from my understanding, talking with Lydia, this is your passion too, to try to get ahead of the problem of child abuse and neglect, to change those conditions that allow child abuse and neglect to occur in the first place. So upstream primary prevention work. That became really important to us. And we tried to think about, how do you get to that? And we were really centered on preventing child sexual abuse, child physical abuse, neglect, and then also kids seeing or hearing intimate partner violence. We include all of those pieces in our definition of child abuse and neglect. So we think about domestic violence prevention as a part of our work. And the thing that we did early on, we were established in April of 2012, and of course built on the work of what many others have been doing for actually decades of advocacy. Our center was established in April 2012. And for really mostly the first 3 years of our effort, we just listened. And we were in places with permission, places like Dairy Marts, which is our local 7-Eleven. They gave us permission. I was a part of this, and many volunteers gave us permission to sit in front of their stores. We were at farmers markets, granges, libraries. We went to rotaries across our county, across these regions, and we asked community members, what do you think we need to do to prevent child abuse and neglect? And through that process, we also did some more randomized telephone surveys in Lane County, and then also in Whatcom County, Washington, which is a comparator county. And in total, we talked with over 12,000 Lane County residents and mostly listened. What do you think we need to do? And in hindsight, for us, it was the most important thing we did, because that shaped everything we'll share with you next. Really listening carefully to what community members said we needed to do. And we did it also, we paired that with a exhaustive literature review. We came across collective impact. We learned more about protective factors. So we eventually adopted the Center for the Study of Social Policy's 5 protective factors and more. But that was vital to our origins, just really careful listening. And as a part of that process, we landed here. And this we think has been useful from kind of a marketing perspective, was to try to communicate with community members, how do you actually prevent child abuse and neglect? We've landed in this kind of these places, that child abuse and neglect is most likely to be prevented when kids are connected, families are supported, and community members take positive action. And that action includes work around anti-racism, doing work around social justice, economic equity, et cetera. So community members take action. That's a large bite of work right there in itself. And then Sara will talk about some of our strategies. I'm going to make one comment about our strategies. So the strategies that we'll highlight, we're going to highlight a few, were selected because largely they had some evidence to support them, or they had historical wisdom. And we really wanted to select strategies that local community members could see themselves doing and could do. So we are almost entirely volunteer based. In every strategy we'll share with you, any one of us would have largely the capacity to do. So we're one of our assumptions is you can't get to nonprofit our way to prevention. Really have to mobilize and engage communities. So here are a few of our strategies, all mapped to the protective factors.
So each of our 7 regions, as we've divided up that map that Jeff showed you, largely kind of based on school district lines, each of those 7 regions has identified and implemented a unique blend of strategies that they think address the needs in their individual community. There is one, however, that across the board, all of our regions enthusiastically embraced, and that is Roots of Empathy. And so we'd like to share a clip about Roots of Empathy with you now.
Babies are 100% accepting and they don't judge. We know that babies love people regardless of how they behave. Their superpower is that they can make you love them. With the help of an instructor, children observe the most powerful relationship in the lifespan. The research calls it the attachment relationship between a parent and a baby. And the children spend time every month with that baby from the time the baby's 2 months old right to the end of school. And they study that baby. They learn about what the baby's feeling. The children fall in love with the baby, and they learn a lot about love from the baby, and they learn about all their feelings. And then they learn how to have those same feelings for other people. Children are the citizens, the parents, and the leaders of tomorrow. And if we want them to grow up, to be healthy, to be mentally well, to be empathic, we need to start today, because they will change the world.
So your official introduction to some tiny teachers in Lane County. The Roots of Empathy program, the instructors are recruited from each of the 7 regions, and those volunteer instructors, 90 by 30 is able to invest in them 4 days of intensive training so that they can deliver this classroom-based curriculum across Lane County. So the instructor makes 27 visits to a classroom over the course of the school year, and 9 of those, they are accompanied by a tiny teacher and attached parent. There's a large body of research, put a couple of points up there, that has consistently shown these things to be true of children who participate in the program, even several years after they've completed their experience in that Roots of Empathy classroom. They continue to see decreased rates of aggression and fewer acts of aggression compared to those peers who weren't able to participate in Roots of Empathy. I actually chose this image for you today. This is one of our Lane County artists, 7-year-old Hunter's. What he was charged with here, because art is a part of the curriculum, is to draw a picture of a time where he felt proud. So I like to pull this one out. What Hunter came up with, a time that he identified as being proud, was when he was able to help Silas, who was terrified, on a classroom slide. And so Hunter, after being a part of the Roots of Empathy program for a couple of months, was able to identify sort of, an intrinsic pride moment, as opposed to, being proud of jumping off a diving board or earning a trophy. What he chose as his greatest moment was a time he was able to help someone, to recognize that someone was terrified, and to help him get down off that slide. And what we do hear from folks who oversee playgrounds is that they can identify the children who are a part of Roots of Empathy classrooms compared to those who do not, that are not, because of their behavior in places like the classroom, or excuse me, like the playground. So I could talk about Roots of Empathy all day, but I do want to share some of our other programs as well. So next, I'd like to highlight the Welcome Baby program. The Welcome Baby strategy is across Lane County, and in 4 of our regions, they are able to deliver the Welcome Baby bundle, which you can see here. So this bundle is delivered by a community volunteer trained by 90 by 30 to do a one-time home visit with a family expecting or that has a newborn baby. And you can see there's lots of beautiful gifts in this bundle, including handmade items by members of the community, like cap and a homemade tummy time quilt. The visitor also delivers the period of purple crying, which is training designed to reduce the rates of shaken baby syndrome. And perhaps most importantly, they deliver a carefully curated binder of local resources for families with new babies. So I think that the Welcome Baby bundle is one of my favorite projects to look at how a whole community can come together. We have teams who are making these homemade items. We have folks who have trained to become a visitor, to go into a home to make additional social connections. We have folks who are carefully curating those resource binder contents, and groups that decide to raise money to sponsor an item. So it's just a really lovely way to see an entire community come together, whether you have an hour a year or an hour a week, to be able to participate in this project. All right, to highlight a couple of additional programs. Safe Families for Children is a national program that 90 by 30 was able to help introduce to Lane County at an annual conference. And we're able to help find a home for our local Safe Families for Children with an organization in Lane County called CAFA. Safe Families for Children is designed to serve as respite for families in crisis, those with urgent needs. Our rural teams are uniquely able to, because they're so embedded in their local communities, to help recruit host families who can care for the children during times of crisis, and also to help recruit and support wraparound services for those host families. In most cases, that wraparound service is with a faith community. So a faith community that helps run errands and provides items, financial support to those host families, because there is no money given to the host family to host these children. But the mission is to support families through this time of crisis and be able to help them stay out of the foster system and be able to have the resilience to get their children to bounce back next time. There's a mentoring program, an ongoing mentoring program available as well, even after the children are out of the respite care, and to be able to get those families back on their feet. The Be Strong Families Parent Cafes is being implemented across Lane County as well. So those are typically, in normal times, a group that meets, could be one time you can come regularly around a specific topic. So it may be caregiving for middle schoolers, it may be self-care during parenting. So the group can come together, have a meal, and then have divide up by tables. And during the times of COVID, we've been able to move this to a virtual platform with a lot of success. And so I think that moving forward, we'll likely have a hybrid to have both in-person and virtual events, because that does make it accessible to some of our most rural folks who may have trouble getting to a more centrally located in-person event. We have a new social justice curricula as well. And so we're excited to implement that social justice and parenting. I also really like the Parent Cafes program because we're able to help nurture leaders within that structure. So folks who maybe attend once and are really excited about becoming a table host and then can move up to an event host. And we are able to provide some training for them and to help them feel confident to be a leader in their own communities. Also, we'll touch really quickly on the relationship check-in, which is a partnership with the Center for Healthy Relationships at the University of Oregon. It's a single appointment focused on strengths, and it's solutions oriented. So whether that relationship is intimate partner or a relationship with your child, it's just an opportunity to strengthen and then provide additional support for families through that one-time service. It's currently delivered via telehealth, and I think that's been really successful and likely will continue mostly in that model. All right, Jeff, our next slide. So I want to share very quickly, we'll put, we have several websites, and one of the ones I want to direct you all to is the knowmorelanecounty.org. That's KNOW. This is really designed to be sort of a public face for folks who are just getting familiar with our work. On this site, you can sort of self-identify in a role. So I might choose neighbor or parent or friend. And then it can give you a number of ways to support kids and families in your community. It may connect you to some of the breadth of incredible agency partners we have across Lane County. And also there are tasks, sort of task-oriented things you could do. So if you identified as a neighbor, for example, you could connect with a neighbor who doesn't have a parent that doesn't have a safe fenced-in yard, and you could invite them to bring their children to your yard at some time to play if your yard is safe and fenced. So very doable, task-oriented ways for any member of the community to say, gosh, how can I support kids and families in my community and therefore reduce the risk of the rates of child abuse and neglect. So I encourage you to take a look at that as well. Most of us will fit into lots of roles, so there's quite a lot to look through there.
Thanks, Sarah. And then again, we'll add these links in the chat box in just a bit, so please do go check those out. And just to give you a little bit more about our origins and then how it led to some of these things that Sara just shared. So before we first began, we organized a forum where 7 presenters each had 10 minutes. This is back in 2011 to respond to this prompt and question. We asked them to imagine that it's December 31st, 2030. And in Lane County, not everywhere, just in our community, Lane County, we've reduced child abuse by 90%. How did we do it? And what do we need to do right now? And they each represented, again, 7 different sectors. And the response to that kind of visioning event, it was an all-day event, there was an unbelievable response that we were surprised by. And the thing that people most said is, what can I do? How can I help? And so we got really organized around very specific things that any one of us can do. So for instance, with the Welcome Baby Bundle, we think about it as a way to build social connection with families in our community. And the beauty, I think, also with this is, for instance, we've received 39 quilted blankets from a group of women who do knitting at one of the local churches. And so they are now thinking about what is child abuse and how do we prevent it? And they wouldn't have maybe made that connection before. And so we've had many ways to engage our community through these kinds of strategies. And here are a few others. And again, this is just a sampling. Be happy to talk with you about each one of these at some point in time if you have an interest. We've been doing quite a bit of work around trauma-informed schools as a way to turn toward trauma, acknowledge that it occurs, and build school systems around trauma and trauma healing. We do work around IPV universal screening. It has applications for pediatricians in our communities. We're a part of and building up a prevention network in our community. And then wanted to just share with you this quick illustration also. A lot of people said, hey, it's important to raise awareness when we ask, what do you think we need to do in education? And so we've piloted a few of these. We did an acting call, volunteer actors came in, and I'm just going to show a brief clip of one part of the work that we're working to build out. We've done 3 of these, and it is really around trying to encourage bystander involvement. And so here's one quick clip. The LTD is a bus that they donated their time and their bus in our community. So just check this out if you would.
I'd like to make a payment arrangement. Yes.
Mom, where are my chips?
Well, can you hold on a minute? David, I told you could have the chips when we got home if you were good. Are you being good?
But Mom, I'm hungry now.
I said no. Now will you be quiet? I'm trying to talk on the phone. Okay, I'm back. Well, as I was saying, I won't have enough money until the 30th.
Mom,
so what I was hoping to do was to post date a payment. Hang on. David, knock it off. Can I call you back? Well,
Okay. Just to give it a little sense of that, what happens in this scenario is mom, frustrated, dealing with a lot of stress, eventually slaps the child. The scene goes to one of the bystanders who is fretting and not sure what to do. So what would you do in that situation? And the scene goes to her talking with a friend over breakfast saying, I saw this thing happen. I didn't know what to do. What could you do? And these are set up then to have a conversation with community members. What could you do in that situation? How can we be involved? And then we go on to do some demonstrations about some ways in which we could be involved. And so we're building out a whole series of these. We're calling it What Would We Do, Lane County?
So I'm going to touch on Child Abuse Prevention Month, April 2021, which is a big year for 90 by 30. While we have a pretty good amount of name recognitions in the rural areas of Lane County, And that was intentional. We started our efforts in the rural areas and our urban, sorry, I'm using that, I should use that in air quotes. Our population center is, at this point, outside of agencies that we work with, we have sort of little name recognition with 90 by 30. So this is a big year for us. We've done our first ad buy, so we'll be seeing our name in public transport across the county. In the bottom left there, you'll see the front and back of coasters that will be appearing under drinks in restaurants across Lane County. And we'll be papering the county with water bottle stickers and bumper stickers. And importantly, we are launching a campaign called the 5,000 Strong. So this campaign is designed to identify 5,000 advocates across Lane County who help us get our work out there. And so that may be by way of a financial contribution, or we ask people to identify as a 5,000 Strong member through some commitments that they make. So following us on social media, reaching out to 5 family members, colleagues, and friends to share our work, hosting a presentation somewhat similar to this to introduce us to people that may be interested in listening to what we have going on. So we're very excited about this, this first time to really get out to everyone across Lane County. You can move on to our next slide for me, Jeff. One of the ways that we are working toward the 5,000 Strong is by approaching businesses and organizations, faith communities, and getting in front of them to do presentations to talk about how they can support our work. And one of the ways that we're asking businesses and organizations to identify as being part of the 5,000 Strong is to let us create an ad. You're seeing here a couple of the social media posts that our talented team of students have created that someone is willing to post on social media platforms, tag us, and possibly print off if they have a place where they can do that and put it up on their facilities. So we're excited about these partnerships with groups and businesses all the way across Lane County. A couple of those. It's one of our favorites, I think, right, Jeff?
Yeah, I love this one.
So in part of our social media emphasis, which is the world of Instagram is one we haven't worked a whole lot in, and so we're very excited to be doing that. We have a talented student who is creating some small pieces for us that are usable on social media platforms, and I'm excited to share one of our very first ones with you all today.
The one word I have is hopeful.
Visionary. Collaboration.
Prevention.
I just have a lot of confidence and hope in it. And yeah, that's the one word I would think of.
Thanks, Sarah. Hey, here's actually then just really our final slide that we want to make a comment about. So this is drawn from the prevalence study, and we really see this as a call to action. For me personally, I've been very influenced by this particular statement. So one of the things we did with the prevalence study, again, we began to see it more as a youth empowerment effort. And we asked youth after they completed the survey, what do you think we need to do? What are your recommendations? And they had a whole series of very clear insights about what they would recommend would happen in this community to prevent child abuse and neglect and to support youth who have, who are survivors. And it was a clear call to action. And this one rings so true. Child abuse and neglect shouldn't be taken lightly. Since we're giving you the information, do as much as you possibly can in every way that you can. And what we've been working to do is to really create a broad and clear pathway around what each one of us can do to make a difference around child abuse and neglect. And it's for all of us. The work is for all of us. And really, you probably all agree with that idea. It's hard to implement that idea. And so we've gotten really organized around how do you actually move from the value of there's a role for everyone to the action. And that's where we've centered our attention. And then here are a few pieces of places we would encourage you to go check out. The No More website Sara mentioned, you can see that. And I think you'll have this PowerPoint. These are live links in that PowerPoint. And then again, we'll drop some into just into the chat. So again, anything that you saw today that we created, if you find it useful, think of it as yours. And we just printed 8,000 coasters. That was an idea that came out of our student group. And there'll be, people will have a Coke or a beer, whatever they're drinking. And as they use those coasters, everyone we've asked, I think with one exception, has said, oh yeah, we'll do that. We'll distribute those. So we've produced them. We produced 8,000 for $860, just to give you a sense of it. And we'll see how it goes. It's the first time we've done it. So great. I think that was, anything else, Sara, to add right here?
Well, certainly we could talk all day, but in respect for your time.
Well, we would love that, but unfortunately we do not have time. But I just want to thank Sara and Jeff for really sharing the innovative programs that they're doing to help reduce child abuse in Lane County. I hope it brings inspiration to our county teams that are joining us today. We will have time for questions in just a bit, but before we do that, we want to really help get the creative juices flowing for those of you that are doing child abuse prevention in your counties. So we will be doing a breakout. So let me just share the instructions for us here. And then if anyone wanted to share in the chat, I will go ahead and get us. So one of the things that came out of it too was just that there are a lot of resources that need to be developed for families that are deaf and hard of hearing. And one of them is parenting classes. I think that there are very specific concerns, very specific cultural things that need to be, I think, thought of when looking at people that have different abilities, also blind and visually impaired folks. So, and if you wanted to connect with any of these folks, please send your email to me. I put my email in the chat. It's Lydia Marquez at allforkids.org. So it is in the chat. So please feel free to do that. Yeah, and so one of our participants in the main room, Ginny, said that it's very important to address deprivation as well. Children who have hearing parents but are deaf or hard of hearing.
We talked a lot about what we've learned from COVID-19 about accessing services and using remote work like this, connecting people across places, whether it's LA County where you could have a 10-mile drive and it takes you an hour, or you're out in Calaveras and Amador County where it's 2 hours to get to a place. So how important we continue helping people access services remotely. And we talked a little bit about utilizing Uber and things like that to help people use transportation like they're doing at a COVID-19 clinic or special transportation and such. So that was a lot of what we discussed as well.
We have a question for Jeff and Sara. How do you address diversity, disproportionality, and make your programs inclusive for different communities? From our friend Jagdish.
You want me to take that, Sara? Do you want to? Or?
You can start on that.
Okay. Well, I think it's an excellent question. We thought about that a lot, and that's kind of work that doesn't stop, obviously. So for me, it's about who's involved. And when we took time, and I don't mean we, Sara and I mean there were actually several hundred people over the first few years of our work, where we went into communities, and we worked to be intentional too, to think about inclusion. So, for instance, I met with several times with the youth of Juventud Faceta, and they shaped our thinking. So we did a lot of youth engagement early on, and then did a lot of partnering with community groups to try to think about inclusion. And we have a long way to go for that. Obviously, we continue to think about that, and just think about it. It is the kind of thing that it's especially about who's involved, and we've done a lot of thinking about who are we, and are we a safe space for those who we haven't engaged yet, and if we aren't, we have some work to do. So just a quick few thoughts there.
I'm curious what kind of data you use to identify what groups are living in your community.
Mm-hmm. Yeah, we've done a couple of things. Some more, what's accessible, what data is available, and so we tap into state and county data that sort of exists. So there's that. But there are, a lot of people in our community who don't show up in that data, and so that was one of the motivations to be regional. So we have across our county, we have 7 regional leadership teams who are made up of people in those communities. And so this is not like centered at the University of Oregon. It's actually centered in each of those local regions. And so it's people in those regions reaching out in ways to connect. And so there's some kind of unofficial data that exists that we try to pay attention to. Yeah.
Great. Any other questions for Jeff and Sara?
Jeff and Sara, I had to wonder, could you tell us a little bit more about the student group that you worked with to create like the business marketing, one-pagers, and it sounded like a very active, great group that's provided a lot to the initiative. Yeah, who is the group, and are there ways that others might be able to connect with similar groups at local universities to make, more support happen?
Mm-hmm, mm-hmm.
That's part of the incredibly unfortunate part of being affiliated with the university is access to students. We have, at most times, a couple of student interns and hired student staff as well. And then a couple of our student staff were able to establish like an extracurricular type group, which Jeff has worked with. Jeff, you want to share that?
Yeah, sorry, I missed some of that. I think I've got some connectivity stuff.
Oh, I had said that one of the things that our student staff members were able to do was establish a student support group through the university.
Oh, yeah.
And you've worked some with them.
Yeah, a group of students formed a formal group now called Students Against Child Abuse at the University of Oregon. So they had, spun other opportunities, and we have a connection with the School of Journalism. And so that has given us an opportunity to connect with youth in a way we wouldn't have otherwise. And happy to do a follow-up. Was that Sara that asked the question? Yeah, to do a follow-up around that. So a lot of the things the visuals that we shared, the coaster idea came out of the student group. The visuals, our Instagram page, which we've reactivated, has been really student-led. And, what we have found also, to say quick, is a high interest from students who really care about trying to do something around supporting families and preventing child abuse. We have had no trouble. Our challenge has been, how do we give all the students who are coming forward enough to do, because there's a lot to come forward. Yeah.
And is that undergraduate students in one particular, like journalism or social work or sociology, or is it kind of a group that's coming from all different departments?
It's quite a mix. It's mostly been in the College of Education in that kind of arena, but more and more now with journalism, with our honors college, and more across campus as we've gained more kind of momentum. So it's a kind of privilege, you know, obviously to be connected with the university, and many of us are within some reasonable distance of a university. But again, anything about that, if any of you want to see more of those materials or know more about how we've engaged students and community members, please reach out. We'd love to talk to you about that.
Thank you.
That's amazing. And I think so innovative to really reach out to, you know, college students who maybe have to do volunteer work, or I feel like some of our younger generation folks really know how to maximize social media and really make some amazing things happen. I know sometimes when I'm creating flyers for some of the events we have, I have my 15-year-old look at them and say, like, what is this? How do you do this? So definitely nice to have that support.
Yeah, I'm with you there, Lydia. Just to give you an example of this too, that we have for April, we have a plan in a social media team that's made up of 8 of our students, and they're doing at least a post a day on Instagram. So you could, you know, just follow it. Instagram, if you go to Instagram and 90 by 30, just pull that up, you'll see what we're working on. And that little 20-second video will show up in there that we showed in the PowerPoint, you know, child abuse prevention work in 1 word. And so, yeah, again, any of that you find that's useful for you, it's yours.
Well, I do appreciate your generosity in sharing all of this information. I just think that this is the way for us to really combat child abuse, is by sharing ideas and sharing it. And so I truly appreciate your openness to let people really utilize the ideas that you've used in your programming. So I feel so fortunate that you and Sara had the time to share with us all of this stuff, and I'm really happy that you are here, and hopefully you're not a stranger to us, and we see you both again in the future to share some more of your wonderful work. So thank you so much again. I just wanted to let everyone know as well that this will be on our YouTube channel, so we will be posting this again in case you missed anything you wanted to share with colleagues that weren't able to join us today, or if you just wanted to watch it again just to hear all of the information. You will get a Survey Monkey in the chat, which will help us sort of know, you know, what went well today, what are things that we could definitely work on. So please fill that out when you get a chance. If you're not able to do it right now, don't worry. We will send it to you in a follow-up email with the link to this webinar, as well as some of the resources that were shared by Jeff, the links and some other resources. We also want you to keep in touch with us. Follow us on Facebook and LinkedIn, and please subscribe to our YouTube channel. Every time we have a webinar, we post it there. We have some other resources that we share there as well. So we just want to, you know, be able to share all of the information that you may need in order to continue to combat child abuse and neglect. So again, thank you all for joining us today and spending some of your morning with us. Again, a big, huge thanks to Jeff and Sara for taking time out of their busy schedules to be with us. We truly appreciate it. And we would like to wish you all a very happy rest of your day.